Hi, I'm Pete May, Director of Communications at Henry Ford Allegiance Health, and I'm joined once again by Dr. Vivek Kak, who is part of our infectious disease team at the hospital. We're on site at 1 Jackson Square, which is where our drive-through screening center is located for COVID-19. Dr. Kak, thank you for being with us here again today. We know you're a busy man these days. What can you tell us about the setup here? What are we doing here exactly, and what do people need to know before they hop in the car and head over here?
So this is our drive-by screening center for COVID-19 patients. The aim is to kind of offload the stresses to the ER so that if you think that you have COVID, we'll have you fill up a bunch of questions to see whether you have fever, cough. Do you fit our criteria for testing? So we are not testing everybody who comes to the door or drives up here. So if we feel that you fit the criteria, then we'll swab your nose and then send you on your way. With the suggestion that until the test comes back, you stay at home. If you feel that you're sick enough that you may have been exposed, the first thing is you should be ready to stay at home for the next 14 days or till the test comes back.
Okay. And what are the symptoms we want people to look out for?
Well, what we are hoping to catch people is before they get really sick. So we are looking for people who have a cough, who may have a sore throat and a fever. So the main thing we are looking for is cough and a fever.
Okay. And resources are limited, I understand, so we want people to call ahead before they come over. Is that correct?
That's absolutely correct. So we are not swabbing each and everyone who thinks they have the COVID, partly because we have a limited amount of test kits and the turnaround time for these tests to come back is still 3 to 4 days. So we want to be sure that we are testing appropriately and limiting our resources so that we don't run out of the test tomorrow and then we have no ability to do this on Thursday, Friday, Saturday.
Great. I'm going to share that number now for everybody. We'll also give the number again at the end of the video. The MyCare Advice Line is 313-874-7500. So I think it's important to note that before you come, we're requiring you to call that phone number, speak to someone at that line, and they will basically give you permission to come get screened. Beginning tomorrow, we're not going to screen anyone who has not first called that line. So we really want to make sure people know that so they're not getting in the car waiting a long time just to be turned away. So we talked about some of the symptoms. What can we expect to see across the state as COVID-19 begins spreading more?
I think the main thing to realize is this is a contagious infection, meaning you have to be in touch with or in contact with somebody who has the infection. So if we don't manage to what everybody else is calling flattening the curve, we'll see the spread to wherever an individual goes. So I think we need to reiterate, if you feel that you've been in contact with somebody who has COVID, or if you have a cold, cough, fevers, chills, and you're not sick enough to go to the ER, stay home, please, for the next 2 weeks. You will do a great deal of good, not only to yourself, but the rest of the people in the country.
Wonderful. We're seeing a lot of questions and comments online, and I want to try to get to a couple of those with you if I can. So one of the rumors that's out there is that the COVID-19 virus is really no worse than the flu. Is that true or is that false?
Well, I think if you look at the data, it's at least 6 times to 7 times worse in terms of the flu, in terms of mortality. Okay. Influenza has a mortality of 0.1%, and COVID-19, in the best case scenario, which is South Korea, has a mortality of 0.65, so at least 6 times. And if you go to Italy and some other places, it's a lot worse. So yes, it's not like the zombie virus where you touch somebody and they're like the Walking Dead.
Okay.
Not everyone dies, but a significant amount of people are still dying from it. We are not going crazy here just doing this.
So we shouldn't dismiss it as being as harmless in some cases as the flu can be.
I think we need to respect infections. That's my mantra. Respect the infection. Even if you're young, you can still get sick with it. Yes, the mortality from China was 0.2% if you were less than 19, but 0.2% of kids is still a large number.
Absolutely. And we have a lot of nurses and care providers that work in the hospital. What are they doing to stay safe during COVID-19?
I think the first thing is we are trying to triage patients efficiently. So if you have a cold or a runny nose and you come to the ER, we are kind of triaging you to the point that the caregiver is going to wear a face mask, surgical mask and gown and glove before they kind of interact with you. And if a caregiver is sick, we are telling them to stay at home.
Right. So bottom line is our staff have been training for this and they're prepared.
We have been training this and we are getting prepared as every day goes by. I think we are still in a lot better shape than a lot of other systems, but training, ongoing training is still important.
Fantastic. Well, we want to thank you for joining us. I also want to share some quick resources for everyone still watching the video. I want to give the phone number for the MyCare Advice Line. Once again, that's 313, area code 313-874-7500. You can also learn more about what's happening here in Jackson and surrounding areas by going to henryford.com/COVID-19 Jackson. And you can learn more about COVID-19 in general by going to henryford.com/coronavirus. Thank you.
Thank you, and stay safe.